advance the ability of the consumer to pay to the providers, to doctors directly. In the primary care called direct primary care, and the specialty care is expanding. In a nutshell, you going to the primary care rather than every time you go and you pay a fee or your insurance pays, you pay monthly fee as a subscription model, $100, and that doctor becomes your agent. That doctor no longer is an agent of the hospital working for the hospital. He or she is available to you 24/7 and is the guardian of your health. Then that's the primary care. When it comes to specialty care, you need knee surgery, you need imaging, and so forth. Then that primary care could become your quarterback, your guardian, your Sherpa, to help you, number one, to navigate the maze of the specialty care, because that is where the majority of that waste happens. Right.
Hello, everyone, and welcome to the Business of Learning podcast. My name is Joao Camargo, and my guest here today is Firouz Daneshgari, who is the founder and CEO at Bowtie Medical. Firouz, thank you so much for being here today.
My pleasure. Thank you for the invitation.
Of course, I'm excited to have this conversation. Why don't we start off with you just telling everyone a little bit more about Bowtie Medical, who you guys are, who you help, and any other context you'd like to share about the business.
All right. As the founder, I'm a surgeon. I'm a surgeon scientist. Before founding the Bowtie Medical, roughly about 10 years ago, I was on the rising steps of or stairs of academic medicine. I started from University of Colorado came to Cleveland Clinic at 2001 to start a new fellowship on what's called the female pelvic medicine and reconstructive surgery. That became very successful. Kind of punched my card to join the Hall of Fames in academic urology, and became the chair of a couple of departments. The last one was at Case Western Reserve University. During that time, the program became again very successful. We were ranked on the top honor rolls of the hospitals in the U.S., the top 10, with the top 10 in the research foundation. So a very prestigious program. So they asked me to serve on the board of this clinical enterprise that was 11 hospitals, $3 billion revenue. And during that time, my eyes opened to a few facts. Facts that what we call in the U.S. as healthcare is truly a sick care delivered by 5,000 hospitals that are really financial institutions. And they play the playbook of any financial institutions with a targeted, basically production line, the gross revenue, the net income. Although the majority, over 60% of the hospitals are nonprofit, but the playbook is exactly the same. And if you look at the research that's been published, actually in the nonprofit hospitals, they have a higher net income than for-profit hospitals. And the fundamental problem with that observation is that the targeted production that the hospitals drive by is called clinical volume. Clinical volume means number of surgeries, procedures, labs, and all other services that we do as diagnostic and therapeutics through the hospitals. They all not 100% good. They all have side effects, complications, short-term, long-term. And that is one fundamental problem. The second one is the seller, which is in this case is the hospital and their employed doctors, have a underlying trust that has been bestowed on them by the consumer, by the member, that I trust you do what is good for me. So in that relationship, when you turn this into a production line, then the job of the doctors change from being truly problem solvers for the patient to protectors of revenues for these financial institutions. So make it simple means that in more than a majority of the markets, over 80% of the doctors now are employed by the hospitals. And through the financial incentives, the hospitals ask the doctors to do more and more and more. And as I explained very briefly, doing more and more and more means probably doing more harms and increasing the cost. And that is what exactly the other research shows, that the medical errors has become number 3 cause of death in the U.S.
Wow.
Are costs continue to go up despite the fact the Obama Care or Affordable Care Act was called affordable. The cost has almost doubled up since Affordable Care was passed in 2010. 2010, the cost of healthcare for a family of four was $18,000 per year. Now is over $34,000 a year.
Wow.
And so, in a nutshell, we have created through this misalignments, we have created the most expensive sick care system in the world that continues to actually not to solve our number one problem, number one health problem, and that is escalation of chronic conditions. Chronic
Mm.
conditions such as obesity, diabetes, cardiovascular, musculoskeletal, mental health disorders.
Yeah.
So every day, so last year we spent $4.5 trillion on the healthcare, and every single day of last year we added almost 200,000 new cases of chronic conditions to this pot.
Wow.
So in a nutshell, we spend the most, more than two or three times the rest of the world on the healthcare. We are getting one of the worst results.
Mm.
So in a nutshell, I when I was serving on the board, I went and participated in an executive MBA program where I did a original research in connecting these dots, discovering these dots, and that's
Yeah.
how I came out and I said we can do better. We as Americans can do better on this, and so I founded the Bowtie, and through ups and downs, currently what we do in the Bowtie Medical is we deliver a comprehensive program. We call it health guardianship, that consists of a virtual primary care in form of acute care, in terms of primary care, in terms of concierge, concierge care in all 50 states, that is surrounded by a virtual specialty care, specialties such as orthopedics, obesity medicine,
Mhm.
gynecology, urology, gastroenterology. So our ultimate aim is to deliver a virtual first services for the majority of need of the population, regardless of where they are, whether they're in the rural area, in the cities, and so forth, at the subscription level,
Yeah.
$65 per member per month, which is less than
Mm.
probably a meal now, or a meal for two
Yeah.
at the dinner, and provide over 90% of their needs. So we can provide all your services that you need up to the point that we need
Mm.
to do a procedure. Uh, and these services includes access to the best priced imaging, laboratories,
Mm.
home care services, and so forth. So
Mm. That's awesome.
it took a little bit long to answer your question, but I think I hit all the important points.
No, this is amazing because I was gonna ask about all of those aspects of the sick care in any case. So you kind of just got ahead of some of my questions. And anyway, so that's awesome. Because there's so many conversations that I've had, and I think I would say a good part of the population is aware to some level that there is so much profit and revenue coming from people staying sick as opposed to allowing them to get healthier. So it's great to hear the foundational story of what you guys had going.
Gio, let me kind of pause you there because I'm a capitalist at heart, and I think that is how the actual capitalism creates prosperity and so forth. There's nothing wrong with making profits.
Yes, great.
The yeah, the profits are made in a free market when there's a basically transparency of information between the buyer and the seller. That is the free market. The problem with the current model of delivery of healthcare, again, I call it the sick care, is the market forces are not working there.
Mm.
So if you allow me, I'll tell you there are three misalignments against the free market forces. One is, again, in a majority of the markets, 80% of the doctors are employed or owned by the hospitals. So when I go to a doctor, you come to me, you are not cognizant of the fact that I'm incentivized to do more tests and more surgeries and more stuff on you
Mhm.
because that's how I'm measured, that's how my compensation is made. You still, in your mind, as a consumer of the healthcare, as a patient in this case, you still think I'm that old, good old doctor in in the neighborhoods. When you come to me and give me $5 or a piece of chicken or egg or something, and I basically protect you against the harms of the world, biological harms, diseases, and
Yeah.
so forth. That's not the case. My relationship with you as an employee, me as an employee of the hospital, relation with you has changed into the fact that basically you have become a source of revenue for me and for my employer. That is the first fundamental misalignment. The second misalignment is you are unaware of how much you're paying for me and my services, my employers, because there's a third party payer involved called the insurance companies or Medicare or Medicaid. The
Mhm.
only sensitivity you have is how much out of pocket you pay or how much deductible you have. Whereas at the end of the day, the total cost of care that you pay either through your employer by the deduction that the employer makes or the contributions they make, or through your taxes, that is what really is here. So if I charge you an $4,000 for MRI and you only pay $25, that 4,000 comes somewhere from your bottom line, whether through your
Yeah.
employer or through taxes. So that is the second misalignment, that basically lack of transparency or disclosure of that information.
Mhm.
And the third one, which I mentioned in our conversation, is because of that third party that is between the doctor, the provider, and you, you've become insensitive to basically what I do. Therefore, it is the only industry in the world or in this country. It is the only large purchase we do without knowing the final price. So
Mm.
when you go to a hospital, when you go to emergency room, you sign on a white sheet of paper that you're responsible for the final charges. And that is a legal document. And therefore, when they send you 30 days later, they send you a bill and they say, this is not a bill, but they send that to your insurance company. Insurance pays X% of that. They send you another balance bill, say, this is your responsibility. And the balance bill out of the insurance has become the number one cause of personal bankruptcies in the US.
Mm.
So because of these three misalignment, and again, the role of the doctors have changed. Number one, a third party payer has become basically the purchaser. It is your money, but someone else is buying it for you. And therefore they pay it to a lot of intermediaries. The pharmacy that is about 20-25% of your cost, you're feeding a chain of, it's called the pharmacy benefit management people without your knowledge. And third one is again the insensitivity that you as a consumer develop is because of this arrangement. So the reason I'm setting this three misalignment, when we go
Mhm.
back and probably you ask me how the bow tie is fixing this, these three misalignment could easily be reversed and make the your healthcare experience extremely
Mhm.
pleasant. Your interaction with doctor, going back to that 100 years ago interaction, that you pay directly to the doctor,
Yeah.
and the transparency of information, and you feel ownership of the money that is spent on your behalf.
Mm. Yeah.
So I have no issues with profitability. As you see, some of the services we pay, from the entertainment to banking, we know that they're making money.
Mhm.
The Netflix went from a whatever to a super $1 billion Amazon. We pay that because they delivered the services with some level of transparency we
Sure.
accept.
Yeah,
That
exactly.
is the problem, fundamental problem in the healthcare, that the free market forces are not working
Mhm.
to the benefit, to the disadvantage of the consumer, the patient, and
Yeah.
frankly to the doctors. The burnout level at the doctors level who are employed by the hospital is at the highest has ever been, because doctors never went to medical school to basically occupy this position. We all went to medical school to help people,
Mm.
and that is a fundamental ethical kind of consequences this misalignment has created.
Yeah. No, thank you for clarifying that. It's great to get those 3 points, as a way to navigate the thought process on why this it works the way that it works, and how are the other solutions that we can do, which is, of course, what you guys have gone on, which is pretty awesome. And I just wanted to clarify one thing about Bowtie. Are you guys strictly, working with directly to the consumers, the patients themselves, in a B2C methodology, or is there also a B2B component of the company?
Both. We do both of them. Number one, we don't call our members, we call them member, and not
Uh,
a patient,
they're not.
intentionally.
Yeah.
And there's a philosophy behind it, because we know that biologically, we all are consumers of healthcare. From the time we are born to the time we leave this earth, we
Mhm.
do have some level of needs. So, and the reason we call it a bow tie is goes back to the bow tie as a risk mitigation model. It's not simply because I wear bow tie, it's the risk mitigation model. You can Google it.
Mhm.
The knot of the bow tie is the risk one wants to prevent, whether it's a fire, whether it's a chemical spill, whether it's a heart attack, airline crash, or any undesirable event in
Mm.
life. You have two choices. You wait for the event to happen or the early symptoms of the event show up,
Mhm.
and then you deal with the consequences of it this side of the bow tie. So if there is a
Mm.
uh, uh, chemical spill, now there is a standard protocol. You cannot wait for the chemical spill to happen. You put preventive measures.
Yeah.
The fire, after we came out of the cages and lived in the structures, we know there is a risk of fire. Therefore, no building can be built without the fire equipment and permission.
Yeah.
My favorite industry is the airline. Less than 123 years ago, the first we turned the dream of humans from for flying into a reality, and within the rather short 120 years, we have turned that into a safest mode of transportation because we
Yeah.
said the not, which is the airline crash, is not acceptable. Therefore, the airline industry is filled with risk mitigation policies, checklist after checklist after checklist.
Yeah. Yeah.
So we think, and in healthcare, that has to be done. We all are at risk. You and me, regardless of it, we are at least when we live in the United States for having chronic conditions. More than 50% of the population, over of 50, have two or three more chronic conditions,
Mhm.
right? So we think the time has arrived to turn all of our scientific knowledge about all these conditions, obesity, diabetes, cardiovascular, pain, and so forth, into a risk mitigation strategy rather than a sick care strategy. Currently, you wait until you have the chest pain, you go to doctor and say, oh yeah, coronary artery is plugged. We know we can basically do much, much better than this. We can identify how and where and why you're at risk for the coronary artery disease way earlier and put risk mitigation strategies, we call them care journeys, in place to prevent that.
Mhm.
And as a result, very much like we did with the infectious disease in the last century, 100 years ago, if we lived, you and I lived in 1925 in Ohio or wherever you are, infectious diseases were number one cause of death, means it was the number one risk event for us, right? And therefore, our life expectancies were somewhere between 40 and 60. With this risk mitigation strategy, with clean water, clean food, vaccination, we came and knocked out the infectious diseases out of existence as the number one cause of death. And as a result, we added 2 or 3 decades to life expectancy. Our life expectancies now are over 7 years, 70, 80, 90s, right?
Yeah.
The super agers are becoming more if we take the same approach with chronic conditions, again, the top five: obesity, diabetes, cardiovascular, musculoskeletal, pain, and take a risk mitigation policy rather than a sick care mentality. I'll wait for you to have the chest pain or become obese so I can make money off of putting a stent in your heart or doing bariatric surgery. We can knock these five conditions out of the ballpark. I would propose within the next 5 to 10 years.
Mm.
As a result, we will gain a number of things. One is we would basically reduce the chronic condition and their burden on people's health span. There's an expanding gap between lifespan, how long we live, and how healthy we live,
Yeah.
right? So can you imagine most of us can live biologically, and that is a fact. We all can biologically live to age of 100 without any chronic conditions. The reason we don't is because this chronic condition, very much like the last century, all of our grandparents could have lived to our age, but the infectious diseases took a toll on them, right?
Mm.
There are, there's I think, whale that ages to 300 years. Biology is the same. It's the meat and bone and the tissue,
Yeah.
right? So that is number one. Number two, when you do this, when you take a preventive, proactive risk mitigation approach to chronic conditions, the knot of the bow tie, you will reduce by over 50% of the cost of healthcare.
Mm.
So currently we spend over 80% of the total of 4.5 trillion on chronic conditions. So that is worth over $2 to $2.5 trillion per year in the US. So if Dodge and all the other administration, they're looking for massive savings of $2 to $2 trillion, healthcare is the number one bucket they have to go.
Hmm.
So that is the kind of the approach that Bowtie Health Guardianship is taking and is advocating.
Awesome. Very, very cool. And I love to thank you for sharing all that. It's great to have these little insights that a lot of people don't really that aren't really fully aware of. So it's always nice to keep learning these things over new things again every single day. So I wanted to shift the conversation a little bit now for into Bowtie itself and the company and the growth that you guys are looking to achieve. And as we've talked about, of course, impact is a huge part of why many entrepreneurs start their things. But if the I keep coming back to this specific quote, which is without a vision, the mission perishes. But without money, then the vision perishes. So money and revenue is always a part of business. So I would love to hear from you when thinking about growth and acquiring more clients and bringing in more revenue for the business. What are some of the obstacles? Let's say you had a magic wand that you could solve just one challenge into your company. There's probably a million different things that you want to prioritize, but one thing that would allow revenue to come in, clients to come in, you wave that wand, that problem gets solved. What problem would you like to solve internally?
Internally is their kind of top to bottom approach and from bottom to top approach. Top to bottom, actually, uh, the Trump administration in the first term and in this term, they're opponent of this free market approach, and there are a number of things they can do, and President Trump did in the first term expansion of that. One is advance the ability of the consumer to pay to the providers, to doctors directly.
Mm,
In the care called direct primary care, and the direct specialty care is expanding. In a nutshell, you going to the primary care rather than every time you go and you pay a fee or your insurance pays, you pay a monthly fee as a subscription model, $100, and that doctor becomes your agent. That doctor no longer is an agent of the hospital working for the hospital.
mm,
He or she is available to you 24/7 and is the guardian of your health. Then that's the primary care. When it comes to specialty care, you need knee surgery, you need imaging, and so forth. Then that primary care could become your quarterback, your guardian, your Sherpa, to help you. Number one, to navigate the maze of the specialty care, because that is where the majority of that waste happens, right?
yeah.
Because the specialty care in the hospitals, that's how they make their money. And again, the independent scientific research shows 50% of the services currently done in that space is a waste. They do it because they can get away with it. No one basically questions it. This partnership between the primary care and the individual facing the specialty care, both from the unnecessary care and also from the pricing. So when you go to an orthopod, when you are under the current insurance, you never ask them how much your services cost for me,
Yeah.
right? In that model, when you do it direct pay, so you want to go and have a knee surgery or arthroscopy, whatever, or any other surgery, you say, what is your price? And I'm paying you directly. That is what the guardianship enables too. So you will have a debit card.
Mm,
Uh, we call it a cash pay, upfront pay. You pay for the services upfront, like anything else you serve it, you buy in it. And again, the Trump administration empowers that. Now all the providers must accept the cash upfront pay. That is a significant saving, both in terms of creating the visibility for the consumer and also stopping the fraud and abuse that exists with the billing system.
yeah.
In the billing system, when you go and they send you a bill, the whole industry has been created to upcode the services that they basically charge you.
Mhm.
And since, again, going back to the initial misalignment, since you're not the one you think you don't not paying it, you don't double check them. You don't double check them. They're charging you $30 for a pill of Tylenol or, XYZ. So from top to bottom, I'll summarize. Expansion of the direct pay for primary care, specialty care.
Hmm.
The second element of that, from top to bottom, again, the Trump administration did to allow the employers to form associations that they can provide healthcare.
Mm,
So they don't have to go through the insurance companies per se. They can go and self-insure. All the large corporations that they have more than 1,000 employees, they are self-insured. This formation of associations would allow the smaller employers, which is the larger size of the market, employers less than 1,000, they're the over 65% of the market, form this association, create a purchasing power, and basically self-insure themselves. That self-insurance itself opens the gate for inclusion of the cost containment and basically other models. From bottom up, the issue goes back, as we were discussing, frankly, this whole concept, the fighting the concept of the sick care versus the healthcare. And again, I'm delighted to hear Secretary Kennedy and Mr. Dr. Oz, when they were appointed, uh, President Trump pointed out that your job is to reduce the chronic conditions.
mm,
So, looking at the diseases, chronic conditions, not from the sick care perspective. Oh, that's okay if I get diabetes because there's a doctor who treats me. No, start joining groups like Bowtie and other companies to basically start doing risk mitigation. So,
yeah,
as the population comes from top with this expectation that I don't want to have chronic condition, my kids, my number one wealth that I can leave for my kids and my grandkids is their health.
yeah,
They say in the
mm,
21st century, the health is the new wealth, right?
yeah. Because
If
the
I
wealthy
can
man,
this,
yeah, the wealthy man wants many things. The unhealthy man only wants one, which is to be healthy,
yeah,
right?
yeah. So
Oh,
to build this up from bottom up by basically creating a healthier population, making free market forces to kind of act, allow this
interesting.
healthy behaving population to go
Yeah,
and purchase the things they want.
yeah,
And then you would remove the barriers that currently exist between, the money that you pay, you can pay for your gym, you can pay for your better grocery store. Those financial barriers will remove when the consumer is in control of the money
mm,
rather than the profits going to the insurance companies or to the hospitals.
yeah,
That is, will create the healthier population and would allow the basically market forces to create a more
yeah.
efficient healthcare.
Awesome, very cool. And then and then once the population can have that awareness, they know that this exists and it's something that it's in their power, and then it becomes much easier to solve all those things on the back end as well.
So
Really, I
that
have
is
one final.
answers,
Sorry.
Jay. Will answer your question that I didn't directly. That's
Oh,
you
sure.
could see we both basically approach the employers, so make them aware and educate them in terms of the self insurance, and we approach the individuals in terms of the healthy. So our model really has the B2B and the B2C components.
Awesome. Very, very cool. And then I have one final question for you here, Faru. Thank you so much for this. This has been awesome. And it's actually not a question from me, though. It's a question from our last guest to you, and they had no idea who you were. So they asked you a question, and here it is. You ready for it?
Uh huh.
The question is, what's one what's the one business jargon that you've used that is worthwhile and has meaning and isn't just business jargon?
Health guardianship.
Hmm.
Health guardianship is what I really have come to embrace as the model that would embrace everything that I said. That my job and our job at Bowtie Medical is not only to provide care to you, acute care, primary care, concierge, and so forth. Our job is to guard your health and, as a result, guard your wealth.
Mm,
As you said, the unhealthy statue, especially during the last few decades of our life, is the number one drainer of our wealth for ourselves and for our future generation. The As a result of this, we will close the gap between the health span and the life span.
mhm.
And can you imagine the productivity we will have in this country and frankly around the world when this model expands in terms of the productive human in their 80s? And imagine if all of us can be as productive as Warren Buffett in our 90s.
Yeah. Yeah.
We will go to Mars
Yeah.
for sure.
Yeah. Bro, thank you so much. This has been such an incredible conversation. I will leave everybody's your links down below here, and of course the book, Health Guardianship. I'm not sure we didn't bring it up in during our conversation, but Farouk has a book which is I believe talks about all the health guardianship, the concepts, and everything else. That's oh, you have it right there to show.
I
Uh,
have it. I have it right here. It's
there you go.
called,
Yeah.
yeah.
So there's the book as well. So I'll
And there is a bottle of remedy there with a butter on top of it. And
there you go.
uh,
There you go. Yeah. So I'll leave the links down below here
awesome.
for the book and also for Bowtie's website. So if you're listening to this episode and you want to hear more conversations like this, if you want to check things out, click the link and please subscribe if you want to hear more chats and you're interested by this conversation. And I will see you on the next episode. Farouk, thank you so much for your time. I really appreciate you. Thank you.
Thank you for the opportunity. I really enjoyed it.